All right, Miss Kayla, how you doing today?
I'm good. How are you doing?
Fine. Can you tell us a little bit about yourself?
Sure. My name's Kayla. I am 26 years old, and I went to University of New Hampshire for occupational therapy. I got my master's there in an accelerated program. It took 5.5 years, and I've been an OT since 2018.
Okay, right. Thank you very much for that information. The next thing I have to ask you is, did you always want to be an OT as a child?
No, I didn't find out even what an OT was until I was, I think, a senior in high school. My mom was talking to her friend whose daughter was going to be a OT assistant at the time. So she came home, told me about it, and I fell in love with the idea of it. So then I started to apply to schools that had OT programs at them.
Okay, quite an interesting way to get in here. How exactly does a person get into this field?
Well, you have to go to a school that has an OT program at it. Either I know people who went just for general studies and then had to apply to the OT program later on, and other people like myself got in immediately as a freshman upon entering the school. So obviously that way is a lot easier because you don't have to apply again, but there is a chance to apply later on in your academic career if you don't know it originally going into college.
Okay, okay. So with college, what are the college requirements? Can you tell us a little bit about the requirements to get in there? Tuition, example, what the tuition is like, what should a person expect, the length of schooling, etc.
Sure. So it depends on what you want to do. A OT assistant or a CODA will need 2 or 4 years depending on the program. And then an OT right now needs a master's, and they're soon turning to needing a doctorate for entry-level practice. So really depends on what you want to do. For me, I did the master's program, and I went to University of New Hampshire, which at the time, I don't know if it still is, was the most expensive state college. So tuition for undergraduate, I want to say, was around 15 to 20,000 a year, and then graduate school is more, I think, closer to 30,000 a year. But there are always scholarships available, academic ones, and ones that you can get through your high school. So definitely look into those before going into college because it didn't cost me as much as it looks like it will on paper. And then the first few years was mainly the general education requirements, mixed in with some OT classes. I really liked my program because the first semester we started with an OT class just to make sure that you were in the right fields, you knew what you were getting yourself into. I know not every college does that, so it would be worth asking the course layout just so you don't get too far into a program without actually knowing what an OT does.
Thank you very much for that information. Do you have any kind of school experience do you have anything interesting about college for you that made you want to drop out or perhaps want to do it more? Anything interesting?
I can't say I ever seriously wanted to drop out. There are moments when you're at the library every night for a week studying for an exam until 10, 11, 12 at night, and you say, I should just drop out, or if you're up all night writing a paper. But once those moments were over, I could see how it was helpful and never actually considered dropping out. I think I was just motivated throughout my whole school experience to continue. And I don't think I have any real defining moments of wanting to push myself, but I was motivated from the beginning to finish it out.
Okay, perfect. That is very, very helpful to somebody who is looking into this field. Thank you very much. Is there any alternative to this conventional college or university that somebody could pursue? Anything else besides what you've mentioned?
Yeah, definitely. There are community colleges. I think those are more so the CODA positions because they don't have as long of programs there. But then there are also tech schools that have programs, I think, for all levels that are more so geared towards people who are working full-time throughout the week and either do night classes or weekend classes or online classes. So that doesn't force you to be in school full-time if you have other requirements in your life.
Perfect, great, thank you. Also, what would you say are the rewards, both financially and, non-financially, or, and also what can a new graduate versus a seasoned therapist expect to make?
Well, we do make pretty good money at this job, so I guess that would be the financial reward. I can live my life pretty well, and I don't have to struggle to make ends meet month to month, so that is rewarding. A new grad, I would say maybe around 60,000, and then going up towards maybe 80, 90,000 as you go on. I know some positions can make more or less, but I would say that's a good ballpark to expect.
Okay, great. And what's the job security like in your experience?
Generally, I think the job security is pretty good. The thing that I liked most about this career going into it is that you can work pretty much anywhere. So even if you start out and you can't find a job in the field that you want, there's always going to be some OT job somewhere. So take the job, figure out what you want to do, and then you can always change later once another position opens up in the career path that you thought that you wanted.
Great, great. Also, is there any challenges going up in the field as you work? What are some of the challenges that a person is, expected to face, and what are the expectations in the field? I mean, in school, as opposed to reality in the field. If you understand what I mean.
Right. So in school, you learn the textbook answers, and you learn the answers that you need to be able to take the board certification test at the end of your schooling. So those are definitely important to pay attention to, but in my personal experience, what I learned the most was through the field works. So those are, in my school at least, it was 2 3-month experiences in different settings. And that's when you actually learn how to work with people, how to do the documentation. So take what you learn at school and keep it in the back of your head, because that will guide your practice, but actually getting in the field is where you're going to learn the most and learn how to work with difficult people, difficult coworkers, difficult documentation, and you can lean on your coworkers at that point to teach you the real life answers.
Okay, to piggyback off what you said, one question I'll have here is, also, what does, you hear a lot in school, your teachers say a lot about the field, what they have experienced, what they do. What is what you hear, how is it in real life? Do you expect to see what they've seen? Is it more? Is it true? Is it real? Do they make it sound better than it is? Do they make it sound worse? What do you say?
I think my professors made it sound a lot easier. In most cases, I think, painted a nicer picture for us, and they told us mostly only about the good things, and I think that was just to not scare us and to get us to the point where we needed to be confident enough to go out and work on our own. But they don't tell you all of the difficult things you have to go through, like dealing with patients falling and getting hurt, or dealing with patients who get sick, or if something happens during your session, and then what do you have to do at that point in the crisis moments. It's not really something you can teach in a classroom, so I think that's probably why it wasn't touched upon. But I think you learn very quickly on your field works how to figure those out. And hopefully you have a good mentor at the time who can help you through all of those challenges.
Great information. Do you think, or how do you think this career has shaped your life?
I think it's definitely made me more compassionate towards other people. I've been able to see people who are struggling with many different illnesses or life issues that I had never been exposed to or never experienced myself. So you have to have the compassion for them. It's also taught me a lot more patience of dealing with the difficult moments, or how to talk to someone that you don't necessarily agree with, and how to just be nice to everyone and understand everyone's perspective.
Excellent, very good. Thank you very much. In this field, in the journey, you've been practicing, what, about 2 years, you said? Okay. Do you wish you had done anything differently throughout the journey?
I don't think so. I am a firm believer that everything happens for a reason. So even if the journey isn't exactly what you planned, it's okay. I went all through my college career wanting to work in pediatrics, and I still do at some point, but when I got out of school, the first thing I did was be a travel OT, which all of the professors advised against, because you are kind of thrown into it immediately and don't get as much mentorship as you would with a full-time position, just because they don't have the time for it. So I had a great experience with that. I loved every minute of it. And then I planned on traveling for a lot longer, and then I ended up taking a full-time position. And that has worked out well too, and I've been working with geriatrics this whole time. I haven't yet worked with pediatrics, but I know I'm still young. I have time to change careers eventually when the time is right, so I wouldn't change anything. I think you just have to roll with the punches and work with what you got.
Excellent, great. Talking about travel, I know that there's opportunity for traveling. Is there a way that a person gets in there, and what is it like? What's your experience with travel? People getting in there, what would you say about it?
I'll be honest, I was so excited leading up to it. I didn't know what I wanted to do when I graduated, and I just knew that I loved to travel and it would be a great way to see the world and make some extra money. Travelers make some good per diem, so it's great when you're first out of college and you don't have any money. So I did my entire first day, and there wasn't much OT help there, and it was the director of rehab's last day working there. And I just felt like I had no direction, no help, no supervision. They just kind of threw me into it. I didn't know what I was doing. So the second I walked out the building, I just started crying, and I couldn't stop. But once I got through that, It was fine. The rest of the week was fine. I talked to my coworkers, I explained the situation, they jumped in and helped. And then from that point on, I loved traveling. I did 3 more travel contracts after that, and I met the most amazing people. I traveled to different cities I never would have seen if I hadn't done it. And it was a really good way for me to grow as an individual after college and gain a lot more confidence having to work on my own.
Perfect, perfect. Thank you very much. You know, we're in this time where the pandemic COVID-19 is affecting people all over the world, and especially this world that we live in the United States. We've seen the effects of it in different healthcare settings. And how has it been for you in your practice? How has the pandemic affected your practice and your profession and the kind of setting that you work in?
Yeah, right now I work at 2 assisted living facilities, and I alternate which day I go to each one. And so during this pandemic, it started out okay. My day-to-day life didn't really change much other than having to wear more PPE. So that's masks, gowns, gloves, eye protection. And then one of my buildings had an outbreak, so I wasn't allowed to go to my second building. And so my hours were cut drastically, and even at the building that I was still working out, the one that had the outbreak, we had a lot less patients at the time. So I had to deal with making a lot less money during that time, or using my own personal time, which was starting to go through very quickly. So that was definitely a personal challenge that I had to face that I didn't think was going to happen as a healthcare worker. During the pandemic, I thought we were going to get more clients on. And whereas in that case, I really wasn't working even close to half my hours. So that was difficult, but it only lasted a few weeks. We got through it. So it hasn't, in the grand scheme of things, it hasn't been too challenging, but the day-to-day life is definitely different with having to wear the PPE. It's harder to communicate with the patients. It's harder to get them to participate when you can't leave their rooms. We've definitely noticed a big difference in the patients functioning who have had COVID, where they're a lot weaker, a lot less endurance. So it's definitely been a challenge to get through it for personal life and work and patient life, but we're all making it through one day at a time.
Wow, that sounds like a challenge there. So I know the patients are also affected, but talking more about people who want to get in the field. I know, of course, livelihood, money, is a big motivation for people that want to get in certain fields. I guess in all fields, it plays a big role. So now that you're saying hours are cut and people are not getting as much hours, like you said about yourself, can we say healthcare is still a secure field for people to get in at this time? Because I know no matter what, people are still going to school to get in this field. I think it's a factor that a lot of people will still consider. If anything were to happen with, in this regard, something like this pandemic or some kind of outbreak, is there ways around it? Is it because of your setting? Is there other settings where people are still meeting their hours, or is it worse in other places?
Yeah, that's a good question. I think it really is setting based. So if you're at the hospital or an inpatient rehab facility, I would think that you either have been working the same hours, or your hours have even been increased just with the influx of patients there. However, in an outpatient facility such as ours at the assisted living facility, or at another outpatient where there's been a lot more precautions taken, or even school-based OTs with schools not being in session and everything having to move towards Zoom meetings, I would think it is a lot more difficult to get into the field at this time. I'm not sure, I don't know any new grads right now to ask them about their experience with getting a job, but I would think it's really setting based on how many hours you're going to get right now.
Okay, great information. Thank you very much. I think we are coming to the end of this, but one important question I'd like to ask you that I think viewers will want to know is what is your advice for a youngster or perhaps an older adult looking to change careers or go to college for the first time, or looking for a career? What would you say that will help guide them into this field? What was something good for you that you did or you heard or you found out that gave you a good insight into what you're going to do? Or in general, you've been practicing for a while, what would you tell a person who is thinking about getting into the healthcare or into OT? What would you say?
First thing that comes to mind is very logistical. Make sure that whatever program you're going into is certified by ACOTE, ACOTE. I know there's some new programs who haven't been certified yet, so if they end up not being certified, then you won't be able to take the board exam at the end of your career, your schooling career. So definitely make sure it's ACOTE certified. And then I would say just follow whatever you want. Don't listen to what other people are telling you to do. Like I was saying earlier with the traveling, I was told by many professors and others not to do it right out of school, to go work for a year or two and then do travel. And I think that's the way I learned the most. And I think that it was very worth it for me. It's not good for everyone. If you feel like you need more supervision, definitely go into a full-time position first where you can get that experience. But if you feel confident and you're ready to leap into it, go for it and just follow whatever you want to do and whatever path you set out. And worst comes to worst, if you hate it, you can put in your 2-week notice at any time and change jobs.
Thank you very much. I know I've asked you for advice, but generally, looking at what we've just discussed here, would you have, you don't have to, but do you have any last words, anything to wrap this up? Anybody?
I will just say that I do love being an OT most days. There are some days that are challenging. You'll go through times where you won't want to do it anymore. But for the most part, I do really enjoy what I do. I love helping other people. I love seeing them reach their goals and be more independent and helping them do the things that are important to their lives. So if you are on the fence about doing it, I think it's a good career.
Thank you. You said something that made me want to ask one more question.
Okay.
I know some physical therapists, which they call PT, and a lot of people wonder, what is the real difference between a PT and an OT? Can you shed a little light on that for us, please?
Sure. I don't know the textbook difference, but from my personal experience, OTs help more with the activities of daily living, or the ADLs. So we will help people be as independent as possible with bathing, dressing, toileting, grooming and hygiene, feeding yourself, things like that. And to be able to do all of those things independently, you need to be able to have good fine motor coordination, arm strength, balance, endurance. So we work on all of those aspects, in addition to really anything the client wants to work on. So say they had a stroke and they can't do their favorite occupation or their favorite activity, such as gardening, we would help either get them back to being able to use their hands well so they can garden again, or we would find adaptations to help them still be able to do the things that they love to do. A PT is more, I think, physically based in the sense that they're helping people walk again. They're building up the leg strength. They also work on balance and endurance so that they can be able to do those things. And the majority of the patients that we get, they all say, I want to be able to walk again. And that's all they can focus on. So PT is very important in that aspect. So there's definitely a difference. There's a lot of overlap too in our settings, but I think just look up kind of what the foundation of each of them are and kind of the coursework that you would have to do for each program and see which more aligns with your values.
Okay, thank you very much. And we're guessing there's a lot of jobs when you finish school, right? Mm-hmm. Okay. You didn't have a hard time finding a job when you graduated?
No, so I graduated in December. I studied a few months for the boards. I found out I passed the boards in April, and then I immediately started calling the travel companies, and I had a job within a month, I think even less than that. So I know other people who it took longer, but those were people who I think were more set on a certain setting or a certain location, where, as before, what I said is there's always going to be an OT or PT job, but it just might not be in the exact setting that you want. So you have to weigh those options and either take the first thing that comes up and eventually move on afterwards, or wait around, do some other odd-end jobs until you can find the one that's perfect for you.
That's interesting, because I remember when I graduated, I'm a PTA, and when I graduated, I took my boards, I think I graduated in May maybe, and took my boards in July, and or June, I can't remember. But when I left, I was living with my mom then, and we were moving to another place. We moved in, and when we settled in, I put in an application that night for a PTA job, and I had seen a lot of different facilities in my neighborhood. So I put in an application for a job around 12 midnight, right before I went to sleep. And 10 hours later, around 10 a.m., I had a call to come in for an interview. And so that was very interesting. I feel like this field, PT, OT, I think most of the healthcare jobs in general, there's a lot of jobs available. So if a person's trying to get in there, I think they shouldn't hesitate. And as you said, it's very rewarding when you can get a person who has had a stroke or something happened to them to be able to get back to what they used to do. So thank you very much for coming to talk to us. I know a lot of people will be blessed with this information. Thank you again.
You're welcome. Thank you.